Good morning, Mr. Speaker. Mr. Speaker, I rise today to provide this House and the public with an update on the Department of Health's Child Care Regulations Program. The first 5 years of life are the most critical periods in children's brain development. As approximately 90% of Bermuda's children are receiving daycare within this period, the aim of the Child Care Regulations Program is to ensure all children have access to happy, healthy, safe, and developmentally appropriate care. Mr. Speaker, child care refers to the care and supervision of children by someone other than their parents, either in the daycare provider's home or in a group setting. Child care is regulated and provided in two types of settings locally: as licensed daycare centers, and I'll refer to that as DCCs, which is the group setting, and the in-home care by registered daycare providers, or DCPs. Child care in Bermuda, also known as daycare, is primarily regulated, Mr. Speaker, by the Children's Act 1998. This act establishes the overall framework for child protection and well-being in Bermuda, including the daycare settings. The Daycare Center Regulations 1999 outline the specific requirements for daycare centers to obtain and maintain a license, and they cover areas such as staff qualifications, child-to-staff ratios, health and safety standards, and curriculum. The Child Care Standards of 2018 provide more detailed guidance on best practices for daycare providers in areas such as health, safety, and supervision, staff qualification and training, curriculum and developmentally appropriate activities as well. And so, Mr. Speaker, the Child Care Regulations Program within the Department of Health is responsible for licensing and registering daycare centers and providers and enforcing these regulations and standards. Working parents need child care to look after their children while they provide for their families during the work week, and child care providers, socialization, and educational benefits for children and quality child care can be a valuable and enriching experience at a critical stage of physical, emotional, and cognitive development. Child care regulations is essential to ensure the health, safety, and well-being of children in care settings. It establishes and oversees compliance with minimal standards for child care, such as the following, Mr. Speaker: staff qualification and training. Child care providers should have the knowledge and skills to care for children effectively. Child-to-staff ratios. There must be enough qualified staff in a child care setting at all times to supervise the children properly. Health and safety standards. Child care settings should be safe and healthy for children. And finally, curricula and activities. Child care programs should provide developmentally appropriate and stimulating activities for children. Mr. Speaker, effective child care regulations promotes quality care that can benefit children's learning and development, and the CCR team works with individuals and centers to raise their capacity to provide high-quality care. And to this end, the CCRP utilizes the Standards for Rating of Service Providers, or STARS, system to evaluate care settings. This comprehensive inspection tool was designed using the Children's Act 1998, the Daycare Center Regulations 1999, and the Child Care Standards of 2018, which are aligned with international best practice standards. Mr. Speaker, in the coming weeks, the Department of Health will launch a public relations campaign before the summer of 2024, and the desired result is that parents and providers clearly understand and share the STARS values, namely striving for excellence, which is the S, T, targeting a play-based approach, A, accountability to children, parents, and each other, R, responsiveness to the individual needs of the child, and S, safe and healthy environments. The STARS inspection allows centers and providers to be recognized for meeting the essential child care requirements as well as those choosing to meet higher standards. It is also another tool to empower families when selecting the right child care placement for their child. Licensed daycare centers and daycare providers must comply with the provisions of the Act and regulations. The DCCs and the DCPs are required to receive at least 3 stars rating, which indicates that the center or the provider has met the minimal requirements that are in the law. Those with 4- and 5-star ratings have exceeded the requirements by successfully implementing additional best practice standards. Following an inspection, centers or providers may need to enhance the quality of care and conditions to meet the minimal regulatory standards, which again is 3 stars. The CCR team offers continuous guidance and support to help meet these requirements. Mr. Speaker, the following are some of the key areas that not only assure compliance with minimal standards but also contribute to high-quality care settings. Child care facilities must be well maintained, free from hazards, and age-appropriate for the children that they serve. These include proper playground equipment, electrical safety, and clean and sanitary conditions. Toys and equipment should be age-appropriate, in good condition, and sanitized regularly. Constant and active supervision is essential, especially during transitions and outdoor play. Defined areas of responsibility should be in place for staff. Children should never be left alone with choking hazards or in situations where they could injure themselves. Mr. Speaker, sick children should be excluded from care to prevent the spread of illness, and clear policies on illness exclusion and return to care should be shared with parents. Hand-washing routines and hygiene practices should be emphasized with both staff and children, and regular cleaning and disinfection of surfaces and toys is essential. Mr. Speaker, ongoing skills training is crucial. Staff should be competent with pediatric first aid and CPR, safe sleep practices, child abuse recognition and prevention, and child development stages and appropriate activities. Investment in ongoing professional development opportunities keeps staff up to date on best practices and promotes continuous improvement in child care quality. Staff-to-child ratios are mandated and based on the children's age and developmental needs. Younger children require more supervision, so lower ratios are essential for infants and toddlers. Activities and curriculum at daycare should be designed to meet the specific developmental needs of children of different age groups, and this includes promoting their emotional, social, physical, intellectual, and creative development. Play-based learning is essential for young children's learning and development, and curriculum and activities should be designed to encourage exploration, discovery, creativity, and imagination through play. A balance of individual and group activities, indoor and outdoor play, and structured and unstructured learning opportunities should be provided. And activities should be hands-on and engaging, allowing children to learn through active participation and exploration while fostering independence and creativity. Mr. Speaker, effective child care regulation helps to protect children from abuse, neglect, and accidents, and our team works closely with the Department of Child and Family Services and the Vulnerable Persons Unit of the Bermuda Police Service for child safeguarding. And these agencies and the courts also assist with daycare staff vetting for the sector. By empowering staff through knowledge and professional development and in collaboration with Bermuda College, the Child Care Regulation Program facilitates growth of a qualified and skilled child care workforce that fosters a safe and nurturing environment for children to thrive in. Mr. Speaker, the CCR team at the Department of Health collaborates closely with the child care sector, implementing initiatives to ensure regulatory compliance and quality improvement. And here are some of the key points, Mr. Speaker. Since 2022, the CCR section has conducted quarterly meetings with the sector, and in 2023 distributed a feedback survey to stakeholders. This collaborative effort led to adjustments in the implementations of the STARS program. The CCR team has improved communications to ensure better understanding of the inspection scoring criteria, outcomes, and remedial actions. And following consultations, the Department of Health adjusted the duration of annual inspections and introduced a 1-month notice period to enhance efficiency and stakeholder readiness. And to ensure fairness and accuracy, annual inspections now allow for reevaluation before the publication of the STARS ratings. Recognizing the financial challenges faced by child care providers, the CCR has facilitated import duty relief for materials and supplies utilized in child care settings, easing the operational burdens. Mr. Speaker, the healthy physical, cognitive, and social development of children during their early years, from birth to age 5, holds immense significance. The ministry is committed to working with the child care sector and parents to ensure that we have safe and high-quality child care in place to protect our children and support working families in Bermuda. And I'd like to take this opportunity, Mr. Speaker, to thank the hardworking team at the Department of Health's Child Care Regulations Program. And if the public, and especially parents or parents-to-be, wish to learn more, I would encourage them to visit www.gov.bm/Child Care Regulations Program. Thank you, Mr. Speaker.